Let's go over the stages of impaired breathing. Respiratory distress, respiratory failure, and respiratory arrest are progressively worsening stages of impaired breathing. Respiratory distress is the earliest stage. The first symptom is going to be shortness of breath. You're going to have an increased respiratory rate. You're going to be using your accessory muscles, which are the muscles that are kind of around your lungs. And you're probably going to have some anxiety and restlessness. Now, when it comes to speaking, you are still going to be able to speak in sentences. Oxygenation in this stage is usually normal. And if you were to have blood gases done, you would be compensating. So they would essentially be normal as well. Now, to stop this, where it's starting, the best thing that you can do is seek help immediately so that you can be started on any kind of medication regime that your doctor thinks is best, and it's going to help you prevent it from getting worse. So that was respiratory distress. Now we're going to move to the next category, which is respiratory failure. In this stage, your lungs can no longer effectively get the air in, get the oxygen where it needs to go, and they can no longer effectively get the CO2 out of your bloodstream. So the fancy way to say that is that your lungs can no longer oxygenate you very well, and they are no longer ventilating you. Symptoms of this stage, remember, you're already going to have gone through stage 1, okay? So these are going to be new symptoms. These are going to be persistent or irregular breathing, weakness, fatigue, confusion, lethargy, cyanosis, which is bluish tint to your skin, and abnormal ABGs. If you were to have an arterial blood gas drawn at this time, they would not be normal. Your oxygen would be low and your CO2 more than likely will be high. The goal of this stage is to restore gas exchange. This does take help from, more than likely you're going to be in an emergency room type situation. Now, the third phase of this is respiratory arrest. This is where your lungs just are not working, okay? So they are no longer helping you breathe. They're no longer ventilating you. They're just not working anymore. So the symptoms of this are going to be pretty obvious, but I'm going to say them anyway, just in case you want to know what all of them are. So the first one's going to be apnea. That basically means you're not breathing anymore. You will be unresponsive. You will have a rapid drop in your oxygen level, and you will not be effectively ventilating. So in this type of situation, it is an emergency situation. You are at a high risk for cardiac arrest as well, and this does require immediate intervention. So the key takeaway of this should be that you need to get help when you start to have symptoms, because this is something that is progressive. You very rarely go from feeling great to immediate respiratory arrest. There are usually stages in there. So it is a big deal. If you start feeling short of breath and you were not feeling short of breath the day before and you feel like something is not right, you're more than likely right and you need to seek medical care. So like I said before, you can get put on medicine or whatever it is that the doctor thinks you need to do. But you do want to get it checked out so that it does not progress to the respiratory arrest emergency type situation. This is something that can be prevented in majority of cases, so please take care of yourself, listen to your body.